Good evening, everyone. I'm Jennifer Kem from Cancer Bridges, and tonight we have a wonderful Zoom on how to stop smoking. And our facilitator tonight is Vanessa Shahu, who is a second-year medical student at the University of Pittsburgh. She's interested in pursuing a career in medical oncology, and she hopes to build long-lasting relationships in the community at Cancer Bridges here in Pittsburgh. She's grateful for the opportunity to aid in the awareness on resources for smoking cessation and uplifting patients as they embark on the path to quitting. So thank you, Vanessa. I turn it over to you.
Thanks, Jen. So I just want to thank you all for joining me tonight. Tonight I'm going to talk a little bit about smoking and resources for quitting smoking for patients living with cancer. And before I do that, I'm going to talk a little bit about what brought me to Cancer Bridges as a medical student, and also going to discuss a little bit about social determinants of health. And just as a reminder, this presentation is based on research I've done this summer, and so will serve as an educational resource. But any sort of medical advice or on treatment should be pursued with a physician. Um, so I'm just gonna clear my screen a little. So before I begin, I just wanted to share a little bit about my experience as a med student. And so every day as med students, we are learning a lot about human health and disease, both the benign physiology of how the human body works, but also the pathology and how disease arises, how we treat it medically and surgically. But at the same time, there's been a growth in medical school curricula across the country, prioritizing student education on the social determinants of health because of the impact they have on our well-being, our access to the healthcare system, um, and ultimately health outcomes. And so to define these a little further, the social determinants of health include social, economic, and environmental conditions into which people are born, grow up in, live, and work. And so this can include an intersection of our socioeconomic status, as well as our neighborhood environment. For example, whether we live in a rural, an urban, or a suburban environment, whether our neighborhood has access to green spaces for exercise, um, whether we are exposed to pollutants, and so on and so forth. Social determinants also include education and health literacy, as well as our local access to healthcare. And another aspect of social determinants can include our community support networks, which are inclusive of our family members, our friends, and our social environments. An example being whether we have someone to take us to a doctor's appointment, or is there someone kind of helping support us if we have a lot of medications to take, who's there kind of serving as our village. And so these are all things I'm thinking about as a medical student. Okay. And when it comes to cancer care, our social contexts and resource accessibility, the things I've touched on briefly, these can impact our access to preventative measures for cancer, as well as screening techniques or screening methods for cancer. It can impact then our stage at which we are diagnosed, as well as our access to and utilization of various cancer treatments, as well as our access to survivorship care or end of life care. When it comes to cancer, we often think about the physiological risk factors, our family history and genetics, or maybe our exposure to carcinogens. But there's research on the social risk factors as well when it comes to cancer, and these can include some risk factors such as low socioeconomic status, exposure to chronic stressors, and lack of support systems. And while this can be seen on an individual level, it can also have a systems-wide impact. And one way in which we see this is with underutilization of newer precision therapies among patients who are on Medicaid, given the cost of these medications. And so I just wanted to bring this all up because I've partnered with the Social Determinants of Health program at Pitt, which led me to working with Cancer Bridges. And so I wanted to give a brief insight into all that I've been learning this summer. And as I mentioned, I've been partnered with Cancer Bridges. I've been getting to know Dr. Nilsson, who is the director at the UPMC Head and Neck Survivorship Clinic, as well as Jen here at Cancer Bridges. And as a student who hopes to go into oncology, I have some goals this summer, which were to aspire to develop a better understanding of public health and the social determinants of health, because of the impact they can have on health outcomes. And then ultimately to begin growing in my preparation to provide equitable care for patients coming from diverse backgrounds so that I could address health disparities at minimum on an individual level, but contribute to systems level change, as part of the next generation of physicians. And ultimately, I believe that becoming an informed advocate for patients happens through continued education, reflection, and community engagement, which is why I've been very grateful to join Cancer Bridges this summer. So, as I've been getting to know Dr. Nilsson and Jen's work here in Pittsburgh and the surrounding communities, it's been clear to me that to address the long-term effects of cancer and cancer treatment, which those effects can be physical, emotional, and psychosocial, cancer care really does extend beyond cancer treatment, beyond chemotherapy or surgery or immunotherapy. I've gotten to attend monthly head and neck cancer support groups led by Dr. Nilsson, where she has had experts in otolaryngology come and speak to patients and answer their questions. I've seen patients foster a very open environment among one another, sharing advice and offering their own testimonies. And so this is an example of survivorship care. And from my research, what I found is that survivorship care improves health outcomes and quality of life for patients, but access to dedicated clinics varies across the US, among different cancer centers, depending on the size of the center. And also another barrier is that patients may not be aware of services offered. And so I wanted to briefly highlight some services, which can include monitoring and monitoring for recurrence of cancer, or of new cancers arising, promotion of healthy behaviors, nutritional support, fertility support, psychosocial and community engagement, exercise, and the list goes on and on. And as I've been thinking about survivorship care, in particular as it relates to the head and neck cancer community, but cancer patients more broadly, I came across a survey at Northwestern University's Medical Center, and it was recently published, and they looked into the survivorship needs of head and neck cancer patients. And what they found was that 41% of the respondents who responded to the survey reported a lack of discussions with their physicians and healthcare teams surrounding smoking cessation during treatment. And this was something of note because head and neck cancer patients are, there is such a prevalence of smoking in that population. And so this kind of got me thinking more about smoking cessation and the needs of patients, who are hoping to pursue quitting. What I've come to realize is that head and neck cancer patients are an incredibly resilient population. They encounter unique challenges, and examples can include difficulties with swallowing, challenges with nutrition and feeding, and also challenges with communication, and speech. And so, for many folks during cancer, tobacco can provide stress relief, comfort, and a sense of control amidst all of the stressors of diagnosis and treatment. And something to stress is that the head and neck cancer population is not alone. No individual patient is alone in this challenge of smoking, because 30% of cancer survivors in the US, ages 18 to 44, have been reported to be smokers. And that's actually double the general population rate, which suggests that there is a lot of work to be done in this population broadly. And the American Cancer Society stresses that people who are smoking, a lot of people have an interest in pursuing quitting. 2 in 3 people who smoke express the desire to quit, according to the ACS, and about 50% of people will try and take that first step towards quitting each year. At the same time, while the motivation may be there, the ACS recognizes that there can be challenges in patients successfully quitting without additional supportive resources from the healthcare system. And so because of that, I wanted to share a little bit more about what resources like ACS are sharing out there. And so there will be more tips to come in the following slides. But first, I wanted to talk a little bit more surrounding social factors and social determinants into the factors that exacerbate and are protective against smoking. because I think these are important to recognize as we counsel patients on smoking cessation. And so, to briefly um, touch on some exacerbating factors, research has shown that exposure to secondhand smoking, as well as social smoking among friends and family, can exacerbate tobacco use among patients. And so this can be cause for conversations with family and friends about smoking. Um, Additionally, patients have valid concerns about fears or about withdrawal symptoms. They may be concerned about what's to come, and that can also be a barrier to quitting. As I had mentioned briefly before, stressors and mental health challenges such as anxiety and depression can exacerbate um, tobacco use. And then stressors such as racial discrimination and living in an under resourced area can also contribute. And I wanted to briefly mention alcohol use as a factor that often coincides with tobacco use as one of the exacerbating factors. Fortunately, there has been research on factors that are protective when it comes to tobacco cessation. And I want to highlight motivation to quit, although it is not the sole factor that can predict a person's journey. It is an important one to kind of gauge when we talk to patients. Um, and then on the opposite end of the exacerbating factors, having a non-smoking smoking spouse at home has been correlated with tobacco cessation among patients, as well as familial support. And then just showing the importance of healthcare access and a strong relationship with the physician. There was research to show that a recent visit with a family physician within 3 months of a person's attempt at quitting correlated positively with the success of smoking cessation efforts. And another factor, of course, is health literacy and education on the effects of smoking on cancer patients' prognoses. Um, People just may not know exactly what smoking may mean during cancer treatment. So it's important for oncologists to have these conversations with patients. And so, with that last point, I've been doing a little research this summer looking at the medical literature to gain an understanding of how smoking does impact patients' health during cancer treatment and how it can actually impact the trajectory of the treatment. And so, um, it's been shown that chemicals in tobacco smoke can contribute to tumor growth while also at the same time limiting the efficacy of cancer therapy. And because of this, smoking during cancer treatment has been linked to increased mortality from cancer. It is thought that in certain cases, smoking may be immunosuppressive. And because of this, it can promote the tumor to grow. At the same time, for patients who are treated surgically, the immunosuppressive effects of smoking can interfere with wound healing, which can cause complications post surgery. It is also thought when it comes to radiation therapy that the toxins that are found in tobacco smoke can cause tissue hypoxia. And so, because of this, it can impact the success of radiation therapy because the radiation therapy relies on it relies on inducing oxidative damage to cancer cells to kill the cells. And so when you take away that oxygen, it can cause issues with the success of that treatment. And then another factor I wanted to mention was the effect on treatment side effects. And so it seems that smoking is correlated with a higher burden of treatment side effects. There was a study I came across that was pretty widely cited, and they found that patients who were actively smoking during treatment had greater issues with weight loss during treatment, with nausea, radiation side effects, and so this is important to kind of counsel patients on because of the severity of the side effects that can arise during treatment. So when it comes to having conversations on smoking cessation, it's really important to consider the needs, both medical, social, as well as emotional, of cancer patients and long-term survivors who may be wanting to take that next step towards quitting. And a lot of the medical literature among experts has called for behavioral risk factors in cancer, such as nicotine dependence, but it could also relate to alcohol use and other risk factors. it's shown that the literature has shown that it may most be appropriate to view these risk factors as chronic diseases that require sensitive long-term management. And there have been what is described a band-aid approach that's been traditionally applied to tobacco use, meaning we have often in the medical system told patients it's bad for you, but not really followed up, not provided counseling. And so there have been calls among experts to overcome that approach and to instead provide longitudinal comprehensive support, as well as motivational counseling to patients. I came across a study in the Journal of the American Medical Association's Otolaryngology journal. And there was a study by these ENT surgeons, and they looked at smoking use among their patient population. And they found that the first 6 months after the initiation of cancer therapy could be a pretty critical period to target smoking cessation. They found that the highest probability of cessation among their patient population in the study did, in fact, quit in the first 6 months. And so this can be an important intervention to target early on in cancer therapy. And then through my research, I came across some guidelines from the National Cancer Comprehensive Network that were published in 2015 for tobacco cessation. And they do a wonderful job talking to both patients, but also physicians' concerns when it comes to tobacco cessation. And they really call for evidence-based interventions that address the patient's and survivors' unique needs, challenges, and concerns. And so I'm going to go a little bit further into those guidelines. So one of the main points that this set of guidelines stressed was that approaching cessation as therapy is pretty critical. We want to integrate it into oncological care, just as any other part of a patient's holistic care when they come into a cancer center. The guidelines also recommended specifically cessation from all tobacco products, not just cigarettes, but also cigars, hookah, chewing tobacco, snuff, and other forms of smokeless tobacco. And they really stressed also the importance that it is never too late to quit, regardless of a patient's stage of cancer, the site of which their cancer is located, or their predicted prognosis. Cessation at any stage of cancer is protective. It protects against recurrences, secondary tumors, and if, as I had mentioned earlier, protects against treatment-related side effects, and ultimately can improve the patient's outcomes. And so they made a recommendation, kind of a three-pronged strategy to support patients. And these are foremost behavioral therapy, which can consist of motivational counseling. Secondly, pharmacological treatment options that can support patients through withdrawal and curb cravings. And the third step was to follow up with patients, to have their oncologist or their primary care doctor follow up to reevaluate their needs, to see if they would benefit from alternative treatment options. I briefly wanted to touch on the behavioral counseling recommendations, and the NCCN guidelines state that brief behavioral counseling can be effective. However, they stress that multiple rounds of therapy sessions with a trained psychologist can be most effective for predicting success of cessation. But they also recognize that for patients who come from under-resourced backgrounds, that cost-free telephone support lines can serve as an additional support. And so I wanted to touch a little bit on the pharmacological options. And the major kind of pharmacological approach is nicotine replacement therapy, also known as NRTs. And so these medications, they provide small controlled doses of nicotine in order to curb cravings and to reduce withdrawal side effects. And they do this without providing the other harmful chemicals that you would find in a cigarette. And so the recommendation for patients is to be non-smoking at the time that they start nicotine replacement therapy. And I wanted to mention this because it's been said that it can be unsafe for patients who are actively smoking to use NRTs because of the combination of nicotine exposure, which could risk overdose. Another option that has been increasingly used is bupropion. And so this is an antidepressant, but it's been found to reduce effects of nicotine withdrawal based on how it acts on dopamine in the brain. And so these are some options that have been tried and recommended for quite some time now in the literature. I wanted to stress the importance of seeing a physician for official recommendations because they can discuss matters on dosing, on side effects of any medications, and they can ultimately provide the best support for you as a patient. Um, I was talking to Jen a couple weeks ago, and she had mentioned something that's on the horizon, which is actually GLP-1 receptor agonists. And so these are the medications that we know are used in diabetes, but also in weight loss most recently. But it's interesting that preclinical studies have shown that these GLP-1 receptor agonists, they actually demonstrate a reduction in nicotine-seeking behaviors in rodents. And then also another additional benefit in rodents was that they reduced hunger among the rodents after they had been exposed to withdrawal. And so this can potentially address concerns over withdrawal that patients may face. And so I wanted to share this because it's on the horizon. It's still very early, but it's just kind of an example of the field is still working towards supporting patients who want to quit. And I think that growth is to come in the future. Um, Touching on the guidelines, the National Comprehensive Cancer Network guidelines, they spoke a lot to physicians as well in their guidelines. And I wanted to touch on these because it can, I think, inform patients and how they approach conversations with their physicians. And so some of the major points that these guidelines made was foremost for physicians and other providers, nurse practitioners, PAs, etc., to maintain regular updates to patient records so they could have accurate information on patients' smoking habits over time. And secondly, it's important for when it comes to providing patient education to talk to patients about the side effects of tobacco use, as well as the risks during cancer treatment. And on the opposite end, to discuss the health benefits of cessation. There's a lot of good that can come, and it's important to have those conversations in a safe space, in a safe environment. Thirdly, it's important for physicians and other healthcare providers to have a trusted kind of a trusted network of behavioral health colleagues that they can refer patients for counseling. And when it comes to gaining a patient or garnering a patient's health history and background, it's important to inquire on past cessation efforts because what has maybe not worked in the past could potentially help inform our practices in the future that we pursue in this physician-patient relationship. Another really important point among the guidelines was that of encouraging patients through the development of patient-directed motivational dialogues. And important during this dialogue is for the physician to maintain a non-judgmental, open relationship, especially because historically things like smoking or drinking or substance use have been stigmatized. And so it's really important for us to overcome that as a medical community so we can provide the best care to patients. And ultimately, when we have these discussions with our patients, a very important part of this is normalizing setbacks as part of the journey to becoming tobacco free, because multiple attempts are common among patients. And it can take a long time before one feels ready to quit, or they may have to kind of bounce back from past challenges. And so it's important to recognize the resilience of our patients and to communicate that to them. I wanted to briefly touch on some resources that I came across while I was doing my research. And so here at UPMC, there is for patients who are treated inpatient, there is a tobacco treatment service that services patients at UPMC Presby, UPMC Montefiore, and also Western Psych. And from what I found, it seems that these teams can connect patients to local resources that they may not know about. Furthermore, at Hillman Cancer Center, all patients are able to access a Quit for Life tobacco treatment program, as well as UPMC provides health coaches who provide a number of services, but one being tobacco use support. And so I've left up the telephone number here, and then the other option is for patients to log in to their UPMC portal and register there to get connected to a health coach. And then also, I just wanted to provide the emails that I'd found for some of these resources at UPMC. There is fortunately also resources that Pennsylvanians have access to. And so the primary one that I found was the Pennsylvania state sponsored tobacco use quit line, which provides basically like it provides medications and 24/7 access to counseling, as well as access to a self-directed goal tracker that patients can use as they're on their journey to tobacco cessation. And I wanted to note that it seems eligibility for these programs could vary depending on a patient's insurance plan, and so that may take a little bit more research through calling the health line. When it comes to this health line, though, it seems that coaches will reach out every so often to check in on patients' progress, to help with accountability, but also to offer support and answer questions that arise along the way. And then, of course, to kind of be a shoulder to stand on, to offer support with challenges and also celebrate victories along the way. And so I wanted to highlight the phone number. It's a pretty quick enrollment over the phone through 1-800-QUIT-NOW. There's also an online website that you can pursue to sign up there. As this presentation comes to a close, I wanted to highlight a little further next steps and advice that I found from the American Cancer Society, as well as the NCCN guidelines. And first and foremost, as I stress from the physician side, but also on the patient side, is to have an open conversation with your oncologist or primary care doctor to mutually assess your readiness to quit and to create a personalized plan for quitting. This plan would initially include selecting a quit date in the near future. And it's important to mark that on your calendar because it can be helpful in helping prepare emotionally and mentally. And so the ACS also recommends when you create that plan with your doctor, discuss if you're open to medications or if you're open to talk therapy, or if they can connect you to a support group. The guidelines also recommend creating a support network that can uplift you during the challenging moments on this journey. That can include your family, your friends, but the guidelines also state it can be helpful if you have a friend or a family member who knows what it's like to quit, or who's on that journey themselves, to kind of be a peer support. When it comes to your quit date that you've marked on your calendar, the guidelines, they recommend telling your family and friends so that you can have that additional external accountability and motivation. But I wanted to just highlight that this can vary from patient to patient, as some of us maybe want to keep it private when we're at the beginning of our journey. And so that's really up to each person on an individual basis, but it can be really helpful to have that additional village of support. The ACS also talked a little bit about the kind of challenges with smoking in terms of maybe wanting to kind of get back into the habit. And so they offer the recommendation to explore oral substitutes, which can include chewing gum or using chewing on toothpicks, or just kind of eating candy that can be helpful in distracting cravings, at least at the beginning of the journey. They also recommend removal of tobacco products from your home. And so this can be challenging to do cold turkey, but they recommend, if it's hard to kind of do all at once, to taper off and reduce the number of cigarettes you're smoking as that quit date approaches. And with what I had mentioned about environmental exposure to smoking, this may be a time as the quit date approaches to have discussions with loved ones about environmental exposures, about limiting kind of that limiting exposure to tobacco from people around you. And I wanted to touch on their recommendation with medication, NRTs, nicotine replacement therapy. So for patients who choose to take this route, the American Cancer Society recommends keeping a very routine schedule because this will maximize the benefit you get from them in reducing cravings. And so it's important not to miss a dose, um, especially as you're starting out with your journey of cessation. And with regards to the quit date, it can be a really emotional day for a lot of people and a challenging one as well. And so it's important to stay busy on that day, keeping up with hobbies, staying with loved ones, family, and friends. Exercising can be helpful because it can help boost your mood. And so they just say kind of plan ahead what you want that day to look like. And finally, one of the most important parts of this journey is to grant grace to yourself for setbacks and to celebrate the periodic victories as well as your resilience. Before I close, I just wanted to share a quote that resonated with me as I was preparing this presentation. I have a loved one at home who went on this journey of quitting smoking. It was a challenge, and ultimately they were able to overcome. And so the quote goes, "The journey of 1,000 miles begins with a single step, and quitting smoking is that first step." And it just highlights how these incremental changes are something to really be proud of and um, to to celebrate. And so with that, I wanted to create a space for all of you attending to share your testimonies as well as your needs, concerns, or messages of wisdom to healthcare providers or to students like myself as our patients and our colleagues here. And before I close, I wanted to acknowledge Dr. Nilsson and Jen again, who have been wonderful mentors for me. I've I've been really grateful to just learn about all of the work Cancer Bridges has been doing in Pittsburgh and beyond in the surrounding communities. Um, it's been wonderful for me just getting integrated into the oncology community here in Pittsburgh as an aspiring oncologist. And so I'm just very grateful, and I hope to continue this partnership for the next 3 years plus as I continue my medical education here in Pittsburgh. And then I also wanted to acknowledge Dr. Hausman and Maseru from the University of Pittsburgh, who are leading the Social Determinants of Health summer program that I've been a part of, and they've been helpful in getting me partnered with Cancer Bridges. So I wanted to acknowledge them. And then just these are some of my references. And thank you all for being here.